open this up so you can see it. And thank you for your patience. Okay, so I hope that you can put things in the chat and I'll try to catch up. Kamal, maybe you can help me keep track of that. If you want to just jump in and interrupt at any point, it's totally okay. You've been at this all morning, so I feel like you could just like turn on cameras, turn off cameras, shout out, whatever you feel good about. The first slide, I just wanted to share with you the team of people that I work with, because it takes a whole group of people to take a look at this work. So Liz and I are both architects, and Scott and Jose are in public health sciences, as is Tatiana. Will Aiken's a cardiologist, and Abe and Julius are ArcGIS specialists. And then some of you may know Maria Nardi because she's the director of parks and she's worked with us on this. And I thought it would be great to share with you a perspective that's that I had shared with some of our psychiatry faculty. And it's really just about how the places that we inhabit can influence and affect our mental health. And so this slide is from some workshops that were done in the UK and Europe. And they involved about 400 and some people, and 75% of the people involved had some personal connection with either a mental health disorder themselves or in their family, or they were caregivers. And they did these sort of art sessions. And the idea was, if we could create an ideal place for mental health, what would that look like? And then they did the word clouds. And if you just take a moment, you can kind of scan these and notice the fresh cut grass, the trees, the idea of the sea and the birds and the wind, these are, and the garden comes up in terms of activities. So these are the kinds of things that we've been hearing this morning from Dr. Oyederin when she talked to us about the importance of outdoor spaces for people. And I think it also came up, when Dr. Sklar was talking to us about social media and kind of what's an alternative to that. And one alternative to that is actually the physical world. So just to back up for a minute, and this will bring familiar from what you've heard already this morning, is what are like the three fundamentals that we know are most impactful in terms of the built environment and our health. And there's just a ton of work on social interaction. The House study from University of Michigan in the 1980s pointed out that all things equal for people across societies, income levels, cultures, the one predictor of longevity and health was the level of social interaction. And then Dr. Oyederin showed us the study that's the, the HUS study. And that was a 2010 meta-analysis, which everybody who went to Dr. Sklar's session knows what a meta-analysis is, looking at all the research studies that are out there. And they actually showed almost a 50% level of increase with people related to the numbers of social interaction. So in other words, to have little social interaction was a predictor that you were, 50% more likely to suffer an early death or less good health. So understanding that, you can put that kind of at one level. Then around 2003, Dick Jackson in the American Journal of Public Health collected studies on physical activity, because if you think about it, from about World War II, before World War II, very few people the number of people who had cars in America was relatively small. People either walked to work or they had streetcars going to work. So their life was essentially walkable neighborhoods, physical activity, walking to grocery stores, carrying things back and forth, seeing each other on the way. So you have built into that environment a certain level of physical activity and social interaction. When you get post-World War II, the advancement of the highways, everybody's in cars, we conducted a kind of terrible experiment on our population. And so what Dick Jackson said is, we need to see what's happening with these really crazy rates that are rising in terms of depression, obesity, heart disease, like what is happening? And one of the big outcomes of this was to show the impact of physical activity and the lack of physical activity. And if you are keeping up with the news, there was just a big study in the New York Times about Alzheimer's disease and levels of physical activity predicting a greater delay of onset, and for people who have it, lower levels of impacts soon for more time in their life. And then this is just listing for you some of the kinds of increases. This is from the World Health Organization guidelines on physical activity. And if you notice what it's associated with on the slide, you can see that obviously physical activity is incredibly important to us. And then greenness started to come into the conversation, I would say about 2010. Our team started to take a look at it. So what you're seeing on the slide is actually data from our team, where we looked at about 250,000 Miami-Dade Medicare beneficiaries, and we looked at everyone's neighborhoods. And we found that people living in higher green neighborhoods had reductions of heart disease, depression, Alzheimer. It's just really impactful, and especially impactful in low-income areas. So with this as the kind of foundation, then we start to take a look at, well, what does this mean in terms of health and behavior? And we found in the first study that we did in East Havana, so let's go back to what provides social interaction. Well, mixed use provides social interaction. If you're in a neighborhood where there are only houses and you go out walking, you can see your neighbors if they happen to be out walking. But if you're in neighborhoods with corner stores and places where there are groceries and things to do, well, then there's a whole world of people you see. And our theory on this was that children benefited from those associations with trusted adults. And we found, in fact, that our children who were on these mixed-use blocks had better outcomes. We also found, interestingly, that children who were on a block with one of a leading healthcare clinic had some of the worst outcomes. And part of that was just the way that was designed on the block, where, there was nothing on the street. All the building was raised up. The only thing on the street is parking. So that led us to saying, well, maybe the way the buildings actually are on the street, it's not just the land use, it's actually the way the building treats the street is important. And we did a study with elders in East Havana as well. And we found that our elders who lived on blocks with what we would call socially supportive features, basically front stoops, balconies, and porches. These are places where you can go outside of your unit and you can say hi to people as they're walking down the street. And there's a kind of interchange in your life that doesn't require you to clean your house and invite people in. And we found that the elders in this study that had that impact, well, you can read on the slide that they basically had 2.5 times more likely to have poor physical functioning if they didn't have these features. So this becomes, I think, gives you a sense of urban design issues that could affect social interaction. And then, of course, parks. The access to parks, this is Bryant Park in New York, but there are huge numbers of studies that show that parks have an impact both on physical activity and social interaction. And essentially, there are enormous studies on parks and mental health and well-being. So if we say, okay, how does that translate into physical activity and depression? There's a terrific study that's out of Brazil that looks at the kind of physical activity, and ultimately just walking and getting outside has lower odds of depression. And you can begin to see how these things are starting to come together. Here in Miami-Dade County, we actually have parks that are designed for senior activity. And I thought it would be interesting for you to see this study, because essentially what it shows is the kind of benefits that we get from our cognitive functions when we exercise. And then children. Physical activity is enormously important. And if you think about the school curriculum and how many children have access to play, this is actually Gratney Park, which Miami-Dade County did in a partnership with, I think it's ABC, the local news station. And essentially the idea was, could every child have access to a neighborhood park? And what might this do? And what we find is that there's an incredible impact immediately, but there's also a long-term impact. So this, I think, argues for beginning to make some of these urban interventions. And then finally, this greenness point. This is the study that I mentioned to you that we did, and I had shown you the little graphic. And this is an example of the neighborhood, and you can see the difference between the two streets. And I put up here for your reading just a study in a Dutch neighborhood that's looking at this kind of green space. And interestingly, they found that the streetscape greenery was in fact predictive of these relationships. Now, if you go back and think about what we've been talking about, well, that makes sense, because if the street is green and it's a little shadier and it's cooler, especially in Miami, and you're out walking and you're seeing your neighbors, well, suddenly, you've put all these three things together. And so in that sense, I thought, okay, so how does this affect us at home? And I wanted to show you this residential green space, because you can see in this area, this is Liberty City. And if you look over to the left, you begin to see it's fairly sparse, and you look over to the right and you start to see that tree canopy. So this is the kind of thing that that I've been talking about. And then I wanted to show you what happens when you put all this together. So in South Miami, Victor Dover and at Dover Cole took, they're really good at these kind of before and afters, but this is actually not a drawing. This is real life. On the left-hand side, you'll see Dorn Avenue in South Miami, which was kind of a typical Miami street. You know, it led to the highway. The cars are parked out in front. There's no street trees. It's kind of hot and barren. And so look at what gets introduced into the right. First of all, the sidewalk gets much wider. So now, you know, two people can actually walk together. Cafes can move out onto the street, which is something we saw during COVID. Notice that there's a kind of paving material that goes across the whole area. So when cars enter it, they know they have to slow down because now there's something different. Also, it makes it easier for wheelchairs to be able to get up, because one of the innovations to this is that you can do a kind of curbless distinction between parking and street and sidewalk, and then the planting of street trees. So once this gets integrated, you know, Dorn Avenue suddenly becomes a destination. It's not the place you have to go in your car, you jump out, you run in, you leave, but this is actually a place where you can get these benefits. So how is this happening in Miami-Dade County? Well, I wanted to point out to you this can happen through our climate resilience. This particular project was in cooperation with North Miami, the city of North Miami. It's a stormwater park. The Van Allen Institute did a competition to say, you know, what can this climate, we have a lot of problems with drainage in this neighborhood and flooding. Could we do a climate infrastructure that would alleviate that? And then what kicks in is Isaac Stein, who's a alum, and his Maggie Stein and Andrew Arquad and Adler Guerrier all work together. Adler's a wonderful environmental artist who's local, and said, well, could we take climate resilience and turn that into something that's beneficial for the neighborhood? And so they took an empty lot and converted it into this park. And I wanted to show you this because there are a number of projects. Penn has been working on a project in Philadelphia. Tulane is working on one in New Orleans where they're greening vacant lots. And their preliminary studies on these are showing higher levels of social interaction in the neighborhood, higher levels of physical activity, lower levels of depression, and lower levels of crime. So we can actually take our climate strategies and start to focus them towards these same directions. We also have in Miami-Dade the Million Trees Miami. So you can call the Million Trees, it's out of the parks, Miami-Dade parks, and you can ask to have trees put in your neighborhood. So what you see here is an example of street trees going into a Miami neighborhood because Miami's trying to get to a goal of a 30% tree canopy. And if you look at the map on the right, you can start to see the changes over time in terms of what is the tree canopy now. Like you see the greener areas and you can see where we need to green. And so this is a terrific project. There's no reason that every street could not be greened. Maria Nardi at Parks has had the goal for some time that parks start at your door, and the street trees are one way to begin to do that. And then another initiative going on in Miami is the Active Design Miami Guidelines. This is through the Consortium for a Healthier Miami-Dade with the Department of Health in Florida Department of Health in Miami-Dade. And this also involves the American Institute of Architects and the Miami Center for Architecture and Design. Cheryl Jacobs is doing this with Marta Biciedo from Urban Impact Lab, and you are welcome to submit and get engaged and participate in it. Basically, what Active Design Miami says is we need to look at these areas, and we just heard about this in Dr. Schaufel's talk about, you know, what is the context in which mental health occurs? And if you think back to that first slide where we saw people telling us, you know, it smells like grass and there's wind. So parks and open spaces are obviously key. Thinking about our development patterns, you know, are we entirely obligated to drive everywhere? Could we begin to create neighborhood centers? Could we have parks in more neighborhoods? The Parks Department would like for all of us to have a park within a 10-minute walk. I would even say a 5-minute walk would be even better. And then is our transportation and mobility system designed for us to get around easily? People who have all levels of ability, various kinds of neurodiversity and physical diversities. And then what about the buildings? Are our buildings really friendly? I mentioned to you at the beginning, a wonderful health clinic, but when its physical dimensions are diminishing to its neighborhood, all that good work that's happening on the inside isn't really serving the neighborhood the way that it could. And so asking, one of the things that I do is to try to work with a lot of the healthcare systems to say, what is it that you're giving to the neighborhood? Are you an exemplar of a healthy community for your neighborhood? So I wanted to, if you haven't seen this, this is the Miami-Dade County Parks and Open Space Master Plan. And I thought it would be valuable for you to take a look at it because you can go online and see it. The link is there. But essentially, this is every resident in the county can walk within 5 minutes to a central neighborhood park or civic space. And if you think about it, this is really building that social interaction into our neighborhoods, that there's a balance of the kind of recreational opportunities, that there's this interconnected network so that you could on a bike actually take that bikeway all the way through the county, going from east to west and from north to south. You can, the Ludlam Trail, for example, project is an example of that. The transit gets you to these parks and civic sites. Right now, Metro Rail is great, and the Underline is a terrific project trying to bring gardens and parks below the Metro Rail. But when you leave the Metro Rail and go into the neighborhood, well, that's the area that we need to thread into, right? And then the idea that park improvements are really responsive to the neighborhood. It's not just a kind of internal, what does the park need, but it's also like, what is the neighborhood? And to do that successfully, the residents need to be involved. The mental health workshops that I showed you, those are all about getting the people who are in the care system to be able to say what they feel are the spaces. And we could have a whole nother discussion where I could show you where some of the outcomes of the kinds of places that people make when they're actually consulted. So moving on from that, I thought what you might like to see are some examples. Okay, so how do we fix this? Because sometimes people will hear this and they'll say, well, that's all great if I were going to go build a new place, but here I am. So what am I supposed to do? Well, these are examples that are in the county's Parks and Open Space Master Plan. The drawings were by the Dover Cole Group, and they're taking areas that you might recognize. You know, this is in Miami-Dade County, this is in Kendall, and you can see, well, what would happen? What kind of improvements could we introduce here? And so what you can see is kind of on the left is existing. There's a grocery store, and this is the ubiquitous condition, right? Where you get a building and it's surrounded by a parking lot. So even if you lived, let's say you lived down here, I don't know if you can see my cursor, but if you lived on the bottom, you'd have to cross a 6-lane road, and then you'd have to walk across, 4 rows of parking. And after taking your life in your hands to do that, you could actually have to walk around the other side to enter the grocery store. So some of the improvements are, first of all, shade trees to make it comfortable, trying to get the cars off the ground and into a parking structure so that we can get more pervious surfaces, which is to say greener surfaces, which would reduce the heat levels, which are also associated with the challenges that we have. And then to start thinking about greening rooftops, narrowing streets so that they're safer to walk, and organizing transit stops in relation to these buildings. And then thinking about sort of courtyard buildings, as opposed to buildings that are objects in parking lots, put the building on the outside so you make streets and sidewalks comfortable and bring those other kinds of service activities inside. And then one of my personal favorites are always putting towers. Like a lot of buildings want to compete for who can be the tallest building. And we could perhaps suggest, well, maybe your whole building doesn't need to be that tall, but maybe we could give you a kind of iconic tower that's part of your building, and we use that for navigation. This is another example. And really, this is like, how can you introduce parks into places where parks don't exist? And I think this is a great example because this is showing you, well, there are, first of all, we see the blank walls, and we know from Jane Jacobs' really early studies in the 1960s. And she wrote about this in The Death and Life of Great American Cities. And she said, what at that time, Lincoln Center, which has now undergone renovation, she compared Lincoln Center and Carnegie Hall. And she said, Carnegie Hall is this dense neighborhood with, people on the street 24/7, people living above, and stores and shops. And Lincoln Center basically cleared the neighborhood and killed it for a number of years. So when you look at this, it's like, okay, so what can we do to that building that has the blank facade? Well, if you look on the right, then the idea is what we call liner buildings. And these are buildings that are about 20 or so feet deep. They line parking garages. They make safer streets. Coral Gables actually passed a regulation that you're no longer allowed to put just blank facades on the street. You have to have habitable space. If any of you have ever been to Boca, the Meisner Park was one of the first projects where they built townhouses as liners in front of the parking garage for the shopping center. And everyone at the time said, well, that's not going to work. Who's going to live there? Well, then they immediately sold for ridiculous prices. And a lot of people live there, and it's really convenient. But what it really did is for the community, it made walkable streets. So if you look over to the right, you can see you've got the transit stop and shade streets, shade trees, and urban plaza introduced. And there's another level to this that we could talk about. I think you probably heard of LEED, which is the Leadership in Energy and Environmental Design. It's a code for buildings to be greener. There's also a thing called LEED development, new development, which is based on public health standards for spaces. And one of the conditions for a project being considered for this LEED ND category is that in fact you have eyes on the street, and that you don't have any more than 20% of your street face with curb cuts or service. So this was ahead of its time, but it's still of our time. And then the last one on this that I wanted to show you is kind of what happens when we move into suburban situations. So this one is looking at, we have all these walls, we have kind of the chain link fence. Is there a way to make that a better walking space, more socially interactive, even greener? And so what you can see is it's the one on the right, increases the tree canopy. It creates an entrance with gateways, which is a message bearing device, like here's where you come. The privacy walls are encouraged to have openings, which can be windows. You see those if you go along Main Highway, for example. Plymouth Congregational Church has a beautiful courtyard. It's enclosed, but there are little window openings all along, and so you can see into it. And then, parking on the street and the sidewalk. And then the last slide is going to a more rural area where the houses are bigger, they're on bigger lots. And so it's like, how do we keep the character of this rural neighborhood, but how can we make it safer and more inviting for the kind of interaction that we know is healthy? And so if you look, essentially there's a walking path that's along the street that's introduced, more street trees, obviously on both sides, and sidewalks. And this is a really important, these are small things with big impacts. And so I thought I would share with you some of the links. So when you get the PDF, you can get these. And I'm always happy to follow up with you on any of the articles that we saw. And I thought what we could do is very briefly, these are the items that I mentioned to you. These are volunteers. The Extreme Heat Task Force, Dr. Cheryl Holder is heading that up with Jane Gilbert, because many of these things that it turns out are good for us are also good for the planet. And the things that are bad for us, the completely paved environments, everybody in cars, everybody driving all the time, well, the things that make us sick really make the planet sick too. So this is really a great opportunity for us to kind of come together and address many of these issues at once, and in the process, create an environment that supports mental health and well-being. So I'm going to stop the screen share so that you can turn on your cameras and we can talk to each other. Because what I think is so important about this is that a lot of what we talk about with mental health, and one of the things that I think came up in the keynote, is how much of the burden is on the family, the patient, to change what they do, for the family to, surround and perform. But what if we say, we're all responsible, and we could make places that are healthy. And we don't need it, although we have various income levels of the places that we all live, we could create an environment that supports every single person, that the environment could support good health and well-being for all of us. And it's not that hard to do. So we can ask ourselves, what can we as a collective group do to create an environment that nourishes health and well-being for our people and for our planet? And I feel like that's a great opportunity. And honestly, I see Karen's here because, Karen has helped me with classes at the University of Miami, where we've asked students to take a look at like the clinic that's in Liberty City, that's right next to a park. And could we connect these things? And could they become more powerful when they come together? And I've worked with people on our consortium, the Health and Built Environment Committee of the consortium. And one of the ideas was, well, the underline's great for all the neighborhoods to the south, but what about the neighborhoods to the north? And how can we connect our transit stops into neighborhoods? I don't know if you all know, but Gwen Cherry Park, for example, there's a Martin Luther King transit stop. But if you get off on 27th Avenue, you don't know that you can walk right straight through to Gwen Cherry Park. So one of the projects that we're working on now with Karen and the team, Barry and Valerie, is, well, can we do some changes in some parks and see if people will notice them and use them? So if you haven't been there, you can visit Little River Park, because there's a brand new crosswalk there, and there's signage, and they're putting in a new gate, and they're putting in new paths. And then they're installing in the bus stops around parks QR codes that tell you, this way to the park. So there's tiny things and there's big things. And I would say for everybody on this call, you can make a difference by taking action at whatever level you are comfortable doing so. So I want to thank you for hanging on and staying late. And then I'd be happy to talk further about this. And as I said to you, you can email me and I'll send you any of the studies that you want to read, because Dr. Oediron put up the study that's really close to my heart, that meta-analysis. And I just know that, this is a group that could share some of these resources. So, okay, so now I should pay attention to the chat, because I'm one of those people that cannot multitask. And of course,
Joanna, if I could very quickly just
you can, and actually everyone can just jump in as we say at popcorn style. Yeah.
I just wanted to say how much I appreciate this presentation. We're talking about mental health. Of course, this is the forum for that, but I myself, on a personal level, didn't realize how much the environment makes such a difference. When, for example, if it rains several days in a row and you can't get outside and do your walking or not, how depressed I personally feel. So, and I have to tell you about somebody that is actually struggling with things, and just the fact we've had a relationship with your group and the Health and the Built Environment for many, many years. And I have seen the changes and just to see the communities from back when the consortium started to where we are now, the great advancements that have been made. We have a ways to go, but just to be able to see some of these advancements have been such a joy. But the little things, I appreciate Maria Nardi saying, just be able to come out of your front door and the sidewalk is your park.
Yes.
There are so many areas in our community where that is not the case, and being able to get together and really work on those things, I think it's going to take a collective. But if people can really understand that planting trees, having that greenery, how much it plays such a vital importance on our mental health. If we can all start that way, how much it means. So I just wanted to thank you for this beautiful presentation, and just how excited I am to be seeing these changes over the years.
Karen, I have to thank you, because when you came to the studio, when I think about some of the students that were in that class and realized that people couldn't get from transit to the health clinic. And then the health clinic, the architects on the health clinic were very excited about trying to well, how can we design this in a way that makes it closer to the park? And what you brought is, for the architects to realize. And then right after you did the studio with us, the Surgeon General of the United States spoke to the American Institute of Architects, and he said, you are all public health workers. And it made a big impact, because we, architects are making these spaces, and we could do so much better. So thank you for, taking the time to come and help. Excuse me. And, as I kind of keep looking at Dr. Oya Darren, because I'm like, maybe we could come over to where you are and take a look at your clinic and, see if we could introduce some of these concepts to the medical facilities too. Yeah.
Be great. That would be awesome.
And Kamal asked, I see where you asked me about, can people get involved in the active design guidelines? Yes, we could give them a link to our Health and Built Environment Committee and to Cheryl Jacobs and Marta, and I can send that. And it's also, I think I put it in the resources of the PDF as well. So yes, and they would love to have, they're doing all kinds of consultations. You can see the current active design guidelines, and then this new one is an upgrade. Because one of the things, and I don't know, I really felt this because when the first active design guidelines were being done, I had just broken my leg, and so I was, getting around with some difficulty. And I noticed that the building where the American Institute of Architects in Miami met, in order to enter that building, I couldn't get in unless I went back in the back past the dumpster, through a hallway. And so that's when everyone has these moments of realization, but people in the disability rights community have been saying this for years. They say, nothing about us without us, right? And so I think active design is trying to embrace, this isn't just about climbing up and down stairs and walking. This is also about making it possible for people with all different levels of ability to be able to enjoy all of these things that we're talking about. So if you bring that mindset, I think they'd super appreciate that too. Is there anything else that you would like to ask or say, or do any of you have any experiences that you think we should pay attention to, or I should bring to the attention of our students? Or actually, I should say, if you have any projects that you think, we need some students to focus on this because we think this isn't producing the kind of benefits it could for the community, just tell me, because we do all kinds of work for not-for-profits.
I was going to ask, in addition to the Health and the Built Environment Committee, what are the arenas that we need to speak up in to bring the idea of active design to the people who have the most power to implement it? Is that local government or?
Yes, well, actually, one of the things that's happening, Karen can probably talk about where they are with this more, but is to get each of our, sorry. Wait. To get each of our 34 municipalities to adopt them into their standards. And some of the municipalities have, Coral Gables, I think has, maybe Key Biscayne, but I think North Miami might have, because, Miami-Dade County, well, I don't know if the county likes it when I say this, but Miami-Dade County is like when you bake cookies and you pull all the shapes out, and the county is what's left on the cookie dough that's got all the cutouts. And so the county takes care of all those neighborhoods that didn't have the wealth and resources to exempt themselves, which, is not to disfavor any municipality. Is good on you that you've formed and you're bringing local government to your communities. But it means there are 34 municipalities with their own sets of regulations. And so what I think this also means, frankly, it's why this whole summit is so important about thinking about the mental health and well-being, because I think we need to kind of come together as a county. We need to cross all these boundaries. We need to understand we're in a South Florida region that is facing tremendous issues with heat and flooding. And, we need to be together. And so, yes, I think getting all the municipalities to accept this, Jessica, is really what we need to do. But then I also think if we could kind of one of the things that the Parks Department has done is to create the Parks I don't know the exact name, maybe it's the Parks Consortium, but all of the Parks Department of all the municipalities, and they all meet together. And the Department of Health in Miami-Dade has done work with that group. And so I think if all of us could think about the organizations we're in and how we could bring more people together who are working in different places, that would be really beneficial for all of us.
Thank you.
Well, I think maybe I've worn you out, so you might want to take a break before we go back to the main room. But if you do have any questions, you can email me anytime. Happy to chat with you. Yeah.
Hi, this is Myra Garcia.
Hi.
I threw my question in the chat, but I, like you, am also challenged when
Oh, I suddenly see it. Oh my God, what are the townie? Okay, it is so interesting you asked. So I don't know if you all saw it. She's asking about the tiny homes and villages and how they can support a healthy environment. And what I would say is they will not do that if you put them out on Virginia Key and send all the homeless people to them. So I'm just going to put that right out there. There's also a really interesting article in Arc Daily. Arc Daily is like this feed which shows you whatever's going on in architecture world, the crazy and the regular and everything. But there's an article today on the fact that tiny homes are kind of like a cool fad, but most people, they don't work eventually, and they're expensive, like they cost more per square foot. What I do think supports a healthy environment, and one of my students worked on this, and you can look her up, Tiffany Banks, Tiffani Banks. She's now actually, she's studying law at the University of Michigan. Tiffany won second place in the Health and Resilience Metro Lab competition because we were doing a project in Lake Wales Northwest neighborhood, and she noticed that the lots were very thin and deep, which, by the way, is really good for urbanism because when you're walking down the street, you have neighbors close to you. But what she realized is with the depth of the lot, they could actually introduce an alley and replat so that someone who owned that deep lot could actually sell or build and lease a unit on what would become an alley. And then you'd start to get these cross-throughs through the neighborhoods. And so this was a way for neighbors who don't have the resources, to upgrade or to fix things in their house, to actually be able to have, to get some income and also to kind of repopulate that neighborhood. So I think to the extent that we should be thinking about our properties and allowing more flexibility so that family and friends and students can start to live a little closer together and we could begin to repopulate, I think that is actually a really good thing. I think creating a tiny home village on Virginia Key for people who are not housed at the moment is a terrible idea. So I've said it. There it is, probably on record now. What do you think, Maria? Myra, is that, I don't know what Myra thinks.
Oh, hi. Well, I was thinking more like proactively, like putting these, definitely not, not as an, just a way to have affordable housing.
Yeah, on your property. Yeah.
For older adults and, or the, for our, of course, our aging parents and
exactly.
So more like a proactive option.
100%. No, I totally agree with you with that. In fact, I really would like one of those for my house, for me, so that I have my own place. But yes, I think that is a really good idea. And I know a lot of families, my sister and I, my sister was in Los Angeles, and we kind of converted a little building that my mom and dad moved into on her property, which worked out great because, the whole family could be there. And what we do need is for zoning to allow that. So you're 100% right. That would be really valuable and it's important. And I think it helps a lot, again, I keep coming back to Dr. Oyederan's talk and also to something that Dr. Sklar said about just kind of the integration of life, right? And if we could begin to take what are now single family homes where people are sort of sequestered by themselves, and then they can't drive and they can't get out. And you could actually build a small unit on that property and have a caregiver live there or someone young. One of the projects that Liz Plater-Zyberg worked on that I thought was great, it didn't actually happen, but it was supposed to be on a site that was a former retreat site. And the idea was to make it into a community where people of various abilities, people with autism and different kinds of neurodiversity could live. And then you would subsidize housing for people who are in caregiver professions like teachers and fire, people in the fire and rescue, so that you could then have a community of caregivers who would understand people going through these kinds of neurodiverse life issues. And it could be a self-sustaining community. So yes, agree. Thank you all.
Thank you so much.
Great to see you. Thank you for hanging on.